September 23, 2016. As you can see in the earlier video, that this dog has a right-sided swelling of the perineum, as seen by the arrow here. And this swelling is actually the stools from the rectum going out through the hernia ring, the right perineal hernia ring, and that's why there's a big swelling and the dog cannot pass motion, becomes constipated, as you can see. So the treatment of choice is to close up the hernia ring, otherwise the stools again get trapped inside the rectum again, and there's a lot of stools, so the dog cannot poop there. All these are hardened stools, he cannot poop. Previously, about 2 months ago, the other vet had sedated the dog and given the dog a watery and soapy enema, and was able to evacuate the stools. But after that, the problem comes back again, and the swelling reappears again. So the permanent solution is to close the ring, close the hernia ring, which is here actually. So once you close the ring, so that the rectum will go back to the normal position, and the motion will be passed out from the anus instead of being trapped in this hernia ring, we call it. So this is a ventral dorsal view of the Silkie Terrier. The complaint was, of course, constipation, and you can see in the video there was a big swelling on the right hand side of the perineum, called the right perineal hernia. You can see on this view, and the obvious view is, of course, the lateral view. Lateral view, you can see very clearly the golf ball swelling here, where all the stools are accumulated. So the surgery is being done now, September 23rd, 2016, at 12:15 p.m. So the vet will open up the skin and then push back the colon, and there will be a big hole there. So this big hole, the vet will close up with simple interrupted sutures. And as you can see from this book is Small Animal Surgery, the pelvic area. So you can see from this book the simple perineal herniorraphy, because that is the best if it can be done. And now this book shows an illustration of a perineal hernia on both sides of the anus, one side and the other side. Now, so the operation is called simple herniorraphy, which is basically to open up the hernia ring and then suture one side of the muscle to the other side. Now in this case, in this book, you can see that the ventral dorsal part, you can see that the rectum is not included in the hernia. The rectum is not included in the swelling as compared to here. The present case of the Silkie Terrier, the rectum is included in the hernia. The arrow is where the rectum is. The rectum is included in the hernia, especially the ventral dorsal view. You can really see the rectum is included in a hernia instead of straight out here. So this swelling is actually the rectum. Okay, so now the solution, the dog is being operated. So similar to this book, and opening the hernia pouch. Contents is mainly rectum in this case, but not in this book. And the content is pushed backwards inside with gauze swabs, and then if you see the muscles, coccygeus, external inner sphincter, and if they are in good condition, as in this case, they can be sutured. So to suture them is, as shown here, from one side, the internal obturator, simple interrupter sutures, to the external inner sphincter. And you can see the drawing. So as many sutures as possible to close up the ring or the hole. The hole is where the rectum comes out in this hole. So just close up the ring, and this is called simple perineal herniorraphy, as illustrated in this book, the simple sutures. So simple absorbable sutures, and then after that, then you subcutaneous tissues are closed again, and then the skin will be closed up. Of course, there should be compulsory castration, otherwise the dog will have this problem again. So now I'm going over this side. Hello, we are one with I go the other side. So how is it now? The muscles are okay? Yeah. The muscles intact, the coccygeus, because it's early, right? Early, the owner got it early. If it's long ago, then it won't be intact. So suture from coccygeus to the other side is the sphincter, inner sphincter. Absorbable sutures, close up the ring, and after subcutaneous, another subcutaneous. Now we are doing the muscle to inner sphincter, coccygeus, close up the ring, and then after that, subcutaneous, and then another one, the skin sutures, and in this case, the dog can pass motion without having to have this rectum coming out from into the hernia, forming a golf ball size swelling.
He starts to finish his food, but
so he's still eating?
He's still eating.
8 years old,
male. Vomiting?
Yes.
Silkie Terrier. Yeah.
So this vomiting is due to this hernia as well?
Possibly. Vomiting what?
One undescended.
Not food, but just
testicle.
Yellow,
On
something.
the right.
Yeah. Okay.
The stool is stuck here, you can feel the stool.
Correct.
Did they do any x-ray? The
No,
other
not
vet?
yet.
No. This side is okay, that's the left side.
But is it considered?
No, don't have the hernia, the left side. So far, don't have.
So do you want to do a blood test as well?
He did already, so
They did, we asked.
they say it's okay.
No, I asked them.
Results?
Ask them to send them, they can send down.
Can I should be able to.
How's the teeth? Let me check.
Teeth.
This is still coughing. There's a swelling here, so what is that? There's a bad swelling here. Let me give them a call. No, give them a call, we'll do it.
Hello. Again.
Because the muscles itself already is very thin.
Right side,
already.
left side.
The other side is overstrained as
Exactly,
well.
exactly. So you have to understand that. So you don't expect like once you fix right, it will never come back, because we have seen many cases right that
Right
after
side.
even after repair, maybe 2-3 years down the road, it come back again.
But not as
Come,
not few months
turn
now.
upside.
No, depends.
Armpit.
Depends on how thin the muscle is.
See the below,
you see.
yeah.
Because this one all is all parts of the body.
Below.
We can't control it, you see.
But it will be better for him to do, right?
Have to do it because we are worried that the organs right we get incarcerated, means that it's stuck inside right,
Hold
and
on.
twisted, and then they won't die. Because when it's twisted right, it means the organs are bad already.
Undescended
but now
one.
currently it's not twisted, it's just impacted.
Correct.
Okay, so now
Okay,
we are
never
worried
mind.
that if you go in, then it twists, then there are problem.
Undescended.
That means now we will do the hernia, then after that we will do the
Neuter, yes. But I have to warn you that there is possibility of reoccurrence.
Wait, see your mouth,
Okay,
open
it
the
might come
mouth.
back, unfortunately.
See the teeth, yeah.
Oh, so first things first is we get us the blood test.
Slowly.
Okay, we have to take an X-ray just to see. Okay. Then
Come on
the
back, the
hernia
back teeth.
surgery itself.
Further back.
Okay, what we'll do is put on anesthetic.
Further
then
back.
we will cut. Then we will push everything back in first.
The
Okay,
teeth is
then
bad
to see how
also.
much muscle there is. If the muscle is not much, okay, then we have to open bigger.
Exposed
then we
roots,
put a mesh.
PM4, yeah.
Okay, but if
This
not,
side.
then we can try to put together and then we stitch, try to create as many adhesions as possible to make a
PM4,
fibrous
okay.
layer, okay, to stop everything from coming.
Check
So
the
he will
lymph
have
node.
to change his diet as well.
Exactly. That's the most important, because now constipation is the root cause.
There's a
you see,
cough.
because when they're straining, then they will increase the pressure to push up, you see.
There's a bad cough. Okay. This is the right perineal hernia, okay. Simple repair, right? Okay, then from one side to the other side, yeah. The colon or rectum has to push back in. Hernia ring. Okay, so basically interrupted sutures. Close the ring. So the final one is the skin, it's being sutured, and then since this right perineal hernia, so there's no left. So castration done? Not done yet. Okay, so this one is the purse string suture for the anus to prevent the stools from leaking out onto the operating area, and so that keep it aseptic. Okay, so this one has a retained testicle on the right hand side. and on the left hand side descended, but has not been neutered since now it's 8 years old. Silkie Terrier. Today is Saturday, 24th September 2016. This 8-year-old male Silkie Terrier, not neutered, had a swelling on the right backside and constipation. He could not pass motion, and the owner actually is a young man. He sent it to the first vet. The first vet evacuated the constipation about 1 month ago under sedation and evacuate by enema the stools. Unfortunately, the constipation came back again. So they brought it to Toa Payoh Vets yesterday. Dr. Daniel operated after an overnight drip, IV drip plus antibiotics. So now it is about 21 hours after the right perineal hernia repair. Now the right perineal hernia, you can see it's on the plaster, is close up, is repaired doing a simple perineal herniorraphy, where the muscles of the levator ani and the coccygeus is sutured separately in simple interrupted sutures to the sphincter of the inner sphincter on the left side. So now it's been done. As you can see, there is no swelling. Now I'm waiting for the dog to poo. He has not pooed yet, despite 21 hours. So other than that, he looks pretty active and healthy. Now there will be a need to castrate or neuter him next week, and I would recommend the owner to do dental as well, because the teeth are really bad. Really bad. It's a nice dog. You can see the teeth. The teeth are really, especially the molars. The molars are already, the roots are exposed, and that's in another video. But so now I just show the post-op of the right perineal hernia repair, and you can see that there's no more swelling here. There's no more swelling. You can see previously there was a big swelling to the right side of the anus, but now you can see the white plaster covering the sutured skin. There's no more swelling. There's no swelling here. There was a swelling there, and in fact it appears that there is a left perineal hernia as well, but appears there is a left perineal hernia, but it's not obvious. It's not obvious. So this is about 21 hours post-op, and the dog is well and active. I'm waiting for him to pass motion. If not, then I have to give him an enema to pass motion. Other than that, he looks okay. Painkillers and antibiotics will be given, and the liver collar is important, because otherwise he'll be biting the wound. Toa Payoh Vets, right perineal hernia repaired. Silkie, 8 years old, not neutered. 1 descended left testicle and 1 retained right testicle, undescended. Presenting signs of constipation and swelling in the right perineal area. Singapore, September 24, 2016, Saturday. The video shows the post-op results of right perineal hernia repair at Toa Payoh Vets 21 hours ago.